Good afternoon and good evening to you all. My name is Sweta Shah, and I'm so pleased to have you today at this event for launching the book, Young Children in Humanitarian COVID Crises, Lessons Learned from the Global South. I'm a fellow at the Brookings Institution, and I'm also a fellow at Georgetown University, and I'm the co-editor of this book. I'm joined today by two other moderators, my co-editor, Lucy Bassett, who's a professor at the University of Virginia, and also my co-editor of this book, and Joan Lombardi, who wrote the foreword for this book, is also a senior fellow at Georgetown University and co-founder of the Collaborative on Children's Issues. And we are also joined today by 6 other authors who come to us from a number of different places, from Bangladesh, from Colombia, from Lebanon, from the Philippines, and I'm so pleased to have all of them with us. But before we get started, so here are our authors who will be speaking today. But before we get started, I wanted to set the scene and the rationale for why we decided to embark on this project and to co-edit this book. So imagine an earthquake affecting your community. Imagine war. Imagine a forest fire. Imagine typhoons. Imagine what children in these situations experience: displacement, separation from families, being in refugee camps, and being constantly on the move. Oops. Now imagine being in one of those situations and learning about COVID-19 in your community. So many children during this time when COVID-19 hit were already in humanitarian situations, and organizations supporting them needed to adjust their programming to deal with double and sometimes triple and multiple crises. So that's why we decided to embark on this project, to make sure that the lessons that were being gathered from research and programming from many countries around the world would be uplifted. This book centers on voices from practitioners and researchers who are working, living, and originating in the Global South. And today, the authors will be featuring, most of whom are first-time authors. Some submitted their manuscripts in other languages. And we're excited to showcase today programming, methodologies, and actionable learning. This book is open source thanks to the support of University of Virginia's Humanitarian Collaborative. The book covers 13 chapters in 12 countries, and the book has a total of over 30 authors from the Global South. So there are many people who've contributed their great work, their research and practice into this book. So now I'm going to turn it over to my co-moderator, Joan Lombardi, to lead you through the first panel.
Thanks, Sweta. I'm really delighted to be here. I want to congratulate, before I introduce the panel, I want to congratulate Sweta and Lucy as they launch this important book, and to congratulate them on this accomplishment. The book is groundbreaking because it brought together the voices and experiences to both sound an alarm, but also to provide a beacon of hope in the midst of crises and emergencies. As I mentioned in the foreword, the book, uncertainty, fragility, and mobility are all terms that have come to define the world today. We know that there are more than 100 million people displaced, almost half children. It's estimated that at least 12 million of these children are young before they are just growing and developing themselves. We know that this number has grown since these chapters were written, and we want to send a message out around the world that we're with you, we're thinking of you as you go through these very difficult times. I'm here to introduce 4 wonderful speakers. We have 2 panels today, as Sweta mentioned. This panel will focus primarily on critical approaches and key ingredients to providing services during an emergency. We'll start with Tabassum Amina, who's an assistant professor who leads the mental health work for BRAC Institute of Education. She will be describe the pilot of providing para-counselors to lead psychosocial supports for the Rohingya children and families during the pandemic. We'll then move from Bangladesh to Colombia, where Estefania Ciralu Castillo, the education coordinator for the International Rescue Committee in Colombia, will talk about Jugar para Soñar, a play-based early education program for Venezuelan children on the move in Colombia. We'll then move to Mari Payne, who's the Director of Education and Outreach at the International Programming for Sesame Street. She's based in South Africa. She'll talk broadly about the adaptations and innovation from Sesame Street globally during the pandemic. And then we'll close the panel with Joy Sampang, who's the Early Childhood Care and Development Advisor of Save the Children in the Philippines, who will talk to us about a very important topic: how do we strengthen leadership during these times of crisis? So with that, let me turn it over to Tabassum.
Thank you, Joanne. Good morning, everyone. So I will be sharing the chapter that is on the Sisters of Peace. Para-counselors lead psychosocial support for Rohingya children and families during COVID-19. So Sisters of Peace is a mental health and psychosocial support effort to support Rohingya refugees in Bangladesh. This model employs young women from the local community as para-counselors who are trained rigorously in psychosocial support skills and have been providing therapeutic services to Rohingya children and families since 2017. Next slide, please. Yes, so thank you. Since 2017, almost 90% of the Rohingya population of Myanmar has fled and crossed the border to Bangladesh, specifically Cox's Bazar area, to save themselves from the persecution of the Myanmar army. And in that population, we see that more than 50% of that is children. And these children and all the Rohingya population, of course, because of the trauma that's affected them from leaving their homes behind and the experience of it, come with a lot of trauma and difficulties. And it was really felt that these children really need a space where they can play and they can have a safe space to sort of heal. And that's where that's when the camps in Cox's Bazar, then we opened up humanitarian play labs for children. And the idea was learning through play, but then we also felt that because of the traumatic experiences, it was important to create a healing space for these children and through these children for the families. And that's when we incorporated psychosocial support for well-being through the incorporation of para-counselors in the humanitarian context. Next slide, please. Thank you. So in these para-counselors who are from the Rohingya community are women who belong to that community, and they go through a very rigorous process of training where they spend 5 days, first 5 days of basic skills training, and they receive skills on how to be empathetic, how to do active listening, observation, case studies, writing cases, and things like that. And through a very, very rigorous process of that 5 days of training, they move on to doing a 1 month of handholding with a senior existing para-counselor, where these new trainees attend or join the existing mentor para-counselors in their sessions to observe how these sessions are held and what's the process. And also during this process, during this 1 month of handholding, there is a psychologist who's also providing supervision to both the mentor para-counselor and the trainee para-counselor. After the 1 month of handholding, there's a first assessment that they go through, which is based on the basic training, the 5 days rigorous training and the handholding process. Once they pass that, they start practicing, and providing service in the community, but under the guidance of the mentor para-counselor. This happens for 3 months, and during this onboarding phase, the 3 months they're under supervision of both the senior paracounselor and the psychologist, and then they move on to getting doing a second assessment. And once they pass that, then they're completely known as full paracounselors, and they can provide services on their own. But they always stay under supervision of a psychologist. And they continuously receive refresher trainings, which includes content from their basic 5-day skill training, but also new content that they come with needs based on what they identify from the community that they're serving. So this is a door-to-door PSS service because what we see is the need for coming out and asking for mental health support is really stigmatized, and people won't do that. But if women go to the women in the households through the children who come to the play labs and show signs of trauma and need for support, then these women are more open to accepting the support of a paracounselor. Next slide. So this is all part of a larger larger psychosocial support model where the paracounselors support the frontliners and then all the psychologists as well. So the impact, if we look at in the paracounselor impact, next slide, what we see is the uniqueness of this model is that the frontliners and pieces are from the community, so they belong to the community. They know the language, they know the people, they preserve the culture because they are part of that culture, and they understand the language and the emotions and the expressions that the women and children come with. Because they're the same gender, women providing service to women, so women are more open to accepting the service. The language barriers are broken because they're from the community, they either know the Rohingya language or they're from they know the Chittagonian dialect, or because which is also very similar to the Rohingya language, so that language barrier does not exist there. And then the interventions are within the community, but it's also acceptable because it's designed with the community and the culture. It's culturally contextualized. Finally, the training of the paracounselors is very flexible, and we've seen that even in COVID with online becoming necessity. This which started as an in-person model, completely training, this was able to move on to an online version as well. So that's where I will end here. Joanne, but that's a sort of very snapshot of what our chapter looks like. And I hope, people will enjoy reading more details about it.
Thank you so much, Tabassum. I think there's tremendous interest out there about this topic all around the world. I'm curious, what surprised you about how people responded to the support?
So one of the things that really we thought that it would be really challenging going in, providing the service, how people would take it. But what surprised us is that the paracounselors, even though they come from the community, they identified that their acceptance in the community and their status in the community changed. People were not only more accepting of them, but socially people actually appreciated them. And the name Sisters of Peace, people actually, they're the Rohingya people are the ones who call them Shanti Rapa, which means Sisters of Peace. So this was not a term that we identified, actually. It came from the community and they identified it. So this gave these paracounselors a status in the society, and the women would be looking forward to talking to these people because they brought peace into their life, and they felt that there was nowhere else they could talk. But these are the women who really impacted their lives just by providing the support of listening and being empathetic and being there for them.
Well, thank you. And we're hoping that that image, Sisters of Peace, spreads around the world. So thank you. We'll come back to you later with a few more questions, but I want to move us on to Estefania, who will take us to Colombia.
Thank you so much, Joan. And this is Jugar para Soñar, which means play to dream. Next slide, please. This project helped us to face the situation of more than 7.2 million Venezuelans who have left their country since 2014, and the over 20.5 million Venezuelans living in Colombia. In addition, we currently, and since 2016, thousands of families in transit, and they are transiting our country by foot, sometimes to other countries from the south or for or for the north. So I want you to welcome to this magical journey of play on the root. So as I was saying, Jugar para Soñar means play to dream. And this project, this initiative aims to strengthen the educational system's early education response to migration through direct services on the road for families on the move, and through strengthening also the capacity of ECD centers and ECD teachers to provide more inclusive education services to families that intend or that chose to remain in Colombia and that are searching for stabilization. So this family here, these characters, they represent these families on the move, which carry their bags, carry their dreams, and of course they go with children, they go with grandparents, grandchildren, and of course their pets. But these characters also represent the 5 skills that play helped us to strengthen. Next slide, please. So this project, this initiative, Play to Dream, has 2 main components. The first of two is the component for families on the move. So the main thing of this component is that we provided play in 4 spots of the migratory route across Colombia. We had these 4 main points and we had 4 play spaces in each one of these spots. And the aim was to provide play sessions that can help families to reduce stress and to be more comfortable and recharge energies to continue their journey. So in these pictures, we see how families engaged not only in play, but also received information for a more secure and to make better decisions during their journey. And we also provided a traveling backpack, which is a play backpack for children and in general families, not only to play in the play spaces on the road, but also to continue playing during the route, during the journey. On the other hand, in the next slide, we see the second component of Play to Dream, which is a component that is addressed to teachers, to ECD teachers. So with this component, we were working for families intending to stay in Colombia in a stabilization process. So in this component, we try to strengthen the teachers' capacity in ECD centers. These teachers face lots of challenges when migrant children started to access to ECD services. So we wanted with Play to Dream to enhance the quality of these services through teacher training for them to provide more qualified services to children. And we also collaborated with national institutions to do so, to apply these trainings in ECD centers, because all of these were along with the public system, so we can also strengthen the educational systems for early childhood development in Colombia. So this is Play to Dream. Thank you.
Well, thank you so much. And another wonderful term, Play to Dream. I'm wondering, how did the parents respond to this? They have so much on their minds. They're moving. They left their home. How are they responding?
They were engaged in play. In each one of the 4 play stations or of the 4 magic portals that we had on the route, they were surprised and engaged in play. And I mean, they were surprised because they didn't imagine how play can help them to release the stress of the route, to just be there on the moment and play with their children and strengthen their affect bonds with their children. So I guess the main reaction was surprise, and then they engaged on these play sessions. And I think that it was also very clarifying for them on how they could apply all these learnings and apply play during the route, because they didn't know that play could also benefit them, not only children, which is more common to think that play benefits children, but they were surprised how much play could help them also to reduce the stress and to continue the journey. And as I was saying, recharge energies, because they needed to continue. They needed to get to their destination, but in a way that could cooperate more with also their mental health and all the benefits of playing during the road.
So this is play as a dual generation strategy. And you have some beautiful materials. I'm sure people will be interested after about how to access some of these lessons beyond the chapter. So we're going to move on. We'll come back to you with a few questions to Mari, and to give us that global perspective on what you've learned along the way in Sesame. Mari.
Thank you so much, Joan. Good day, everyone. Sesame Workshop had the opportunity to publish 2 chapters in this amazing book, chapter 8 and 9, respectively, focusing on how we adapted our formative research processes as well as our ECD programming on Sesame Street in Global South contexts. These chapters were written in collaboration with numerous educational technical experts of Sesame Workshop based in countries such as Brazil, Colombia, Mexico, Jordan and Lebanon, Bangladesh and India, as well as Nigeria and South Africa. And I have the honor to represent all of them today. You can go to the first slide. Chapter 8 of the book highlights the adaptive programming approach undertaken by Sesame programs in the Global South. However, focusing on South Africa, Takalani Sesame, which is the local adaptation of Sesame Street in South Africa, had season 12 of production scheduled to commence in 2020. The focus was on playful problem solving to emphasize teamwork as well as diversity and inclusion. However, the onset of the pandemic, it necessitated us to do a shift in our production methods to ensure the safety of all our cast and crew. Additionally, Takalani Sesame productions involve a bustling studio environment, accommodating numerous staff, including camera crew, script writers, puppeteers, and child actors. In response to the pandemic's second wave, and in the absence of vaccinations at that time, modifications were made to the production process. Filming was moved outdoors to enhance ventilation and allow for social distancing, with Muppet and child actors not filmed together at the same time to minimize the risks. Strict adherence to South African COVID-19 safety protocols, such as wearing masks, regular sanitation, was maintained throughout the filming period. This implicated post-production as well. We had to take on a different approach. As separately filmed segments had to be put together in the post-production process. To convey the authentic interactions between the Muppets and the child actors, the team creatively utilized split-screen technology to merge footage, ensuring that interactions appeared genuine and aligned with the Takalani brand. So on the first slide here, you can see what a typical production set looked like pre-COVID, with lots of people interacting together. And on the next slide, Sweeta, they can see during COVID-19 what a production set looked like typically, with children being filmed separately from Muppets and being socially distanced. And if you go to the last slide. So from 2019 to 2021, Sesame Workshop developed a suite of media content, and this was called Watch, Play, Learn. And as part of the rigorous Sesame model to develop content, we use formative testing to test our content in terms of relevance and appeal and comprehension. This was tested across 30 countries globally. These videos aim to deliver playful early learning to children worldwide, with a focus on addressing the needs of children affected by crisis like conflict or displacement. The research process involved using animatics, which is a preliminary animated sequence with children and their caregivers to gather insights. Findings and recommendations are then provided to the production and education teams to refine the content and enhance the appeal, relevance, and comprehensibility. To ensure consistency across different regions, The set of tools is developed by our New York-based Sesame team, and then it's adapted by country teams for cultural relevance and translated into multiple languages. However, at the onset of the pandemic, it also necessitated us to do adaptations in our research methodologies. Due to lockdowns and school closures, each location made specific adjustments based on their local COVID-19 restrictions and the technology accessible to families and young children, including displaced families. These case studies demonstrate how Sesame Workshops teams adjusted study designs and methodologies, including both in-person and remote approaches, amidst evolving safety protocols and restrictions during the pandemic. And I urge you to buy the book or download it and read more about this amazing work. Thank you.
Thank you so much, Mari. You have a unique perspective. You implemented something all around the world. What surprised you about how people responded in different localities?
John, so Sesame always has a model where we work closely with local implementing partners. So in countries where we did implement direct services and community programs on the ground, a key thing is your partnerships with municipalities, governments, and other implementers. And this was even more prone during COVID-19. We were overwhelmed and surprised on how people responded to our content, the need for our content, asking for the content, and the usage of our content. Not in South Africa, but globally and used in other territories. During that time, we also developed content focusing on socio-emotional learning and emotional well-being. And given that we knew it was important content at the time, we were also overwhelmed and surprised of the dire need and the uptake of this content during that time.
I can imagine, particularly around the new material on social emotional development, and I'm sure people listening are going to want to be able to access some of that, so we'll come back to you. But let me go to the last speaker before I ask all the panelists to join me back for a few questions, and turn it over to you, Joy.
Thank you, Joanne. Good day, everyone. Today, I'm excited to introduce an initiative that aims to empower the often overlooked resource in our communities, the early childhood development leaders. In the Philippines, a nation grappling with both natural disasters and armed conflict, it is our children who bear the brunt of these adversities. With an average of 20 typhoons annually and a backdrop of decades-long conflict in the southern region, thousands of lives, especially those of young children, face disruption and displacement. On top of this, the indicators highlighting the plight of Filipino children are alarming. 71% of preschoolers don't attend early childhood education, jeopardizing the readiness for school and future learning. The COVID-19 pandemic has exacerbated child poverty, and violence against children has surged significantly during this crisis. Despite commendable laws like the Early Years Act of 2013, the first 1,000 Days Law of 2018, and the groundbreaking Children's Emergency Relief and Protection Act of 2016, which ensures the protection of children before, during, and after emergencies, the persistent gap between policy and implementation remains. While the National ECCD Council supports the local governments, challenges emerge in translating laws into action. Essential local ECD leaders lack experience, hindering effective program planning. Bridging this gap is crucial for ensuring every Filipino child has access to quality early childhood development programs and services. As we witness globally, effective management and leadership are crucial for delivering quality early childhood development. Unfortunately, many low and middle income countries, including the Philippines, face challenges in defining and prioritizing the responsibilities and professional development of ECD leaders. In response to challenges and emerging needs during the pandemic and other emergencies, Save the Children introduced SLEC model, or the Strengthening Leaders in Early Childhood model. It's a first of its kind initiative in the Philippines. The SLEC model is a comprehensive approach addressing critical competencies and training needs of ECD leaders. It includes a competency framework for effective ECD leaders and a training program designed to approve plans, policies, and programs in alignment with the Nurturing Care framework. Let me highlight three key elements of the model. On the first, on competency framework and standards, covering positive work habits, professional training, administrative skills, pedagogical leadership, rights advocacy, and community partnerships. On the second one, the training program, it's a 4-month program with 5 modules, combining synchronous and asynchronous sessions to inspire leadership, identify strategies for implementing nurturing care, and encourage self-reflection, support action planning, and facilitate sharing of experiences among ECD leaders. The third element is the hybrid approach, recognizing the challenges in internet connectivity and demanding work schedules. The model utilizes a hybrid approach. It's a combination of remote and in-person sessions, ensuring the leaders receive the necessary support for capacity building and technology use. Reflecting on the pilot phase, Save the Children acknowledges lessons learned and commits to focusing on program content, duration, and addressing challenges such as internet connection and scheduling conflicts. There is a commitment to building a supportive ecosystem through an advisory group composed of relevant national government agencies and incorporating psychosocial support. So the SLEC model is not just a response to immediate challenges, but a visionary step towards establishing a standardized and impactful system for ECD leaders in the Philippines and beyond. It is a testament to Save the Children's dedication to nurturing care for all Filipino children, especially those facing inequalities and discrimination. Thank you very much. You can read more about it on chapter 11. Back to you, Joanne.
Thank you so much, Joy. Before I ask all the panelists to join me, I'm curious, Joy, what elements do you think are most important about leadership during emergencies?
Yeah, so in ECD and emergencies, and based on our experience, distributive leadership is crucial, no, for effective decision making and problem solving. So this approach has elements that empower individuals by decentralizing decision-making authority, fostering a sense of ownership and accountability among the team members, which is crucial in multi-sectoral ECD. It recognizes and values the expertise of each individual, so from the teacher, from the health workers, all of them, encouraging them to take initiative in finding solutions. And adaptability is key, as leaders must be flexible and responsive to the changing circumstances. So by embracing distributive leadership, we promote a collaborative and inclusive environment where everyone's strengths are valued and leveraged to achieve their shared objectives in humanitarian settings.
Such an important concept. So I'm going to ask all four panelists turn on their videos so we could just have a brief conversation. I know there are questions, there may be questions from the audience, but I also have some. I want to make one comment. All of these different initiatives that you've heard are emerging from Save the Children, from IRC, from Sesame, but they don't belong to one group of people. I hope that we share this across labels in the future, because that's what people need during emergencies. But let me move just through a few questions that have been raised. Tabassum, what are your recommendations for people who want to launch a similar program of support to mental health? Because it is one of the areas we hear the most about.
Yeah, thank you, Joanne. So if I'm talking about like the our model, if we want to implement that, then it's, you know, it's one of the models where we've developed it to be easily in context, you know, context specific, as well as context, we can be contextualized, right? So that's like, and also the beauty of this model is that it's developed in the Global South, and we have already been able to implement in different settings. So if it's properly, you know, if it's properly contextualized, it's really easy to implement in different areas if we want to. But at the same time, if you're thinking about, you know, if you're thinking about like developing a model and implementing it in the mental health sector, a different kind of a thing, then I think I would suggest there's two primary things is very important. Firstly is I would like to emphasize on the importance of community involvement. So, the people who will benefit from the initiative need to be really included in the process, even before the implementation of the project or the program, because it's very pertinent to understand the culture, the mindset, and then the practices of the community where it will be implemented. So it's necessary to understand sort of like the symptoms or expressions of those symptoms for the people, and be able to understand how those expressions influence a person's language and culture. So that's one thing I think is really important, like working with the community. And secondly, I think that the training has to be really well developed and it has to be really rigorous, but at the same time, it needs to be really simple to be able to make it, successful. Because it needs to like in the case of like our paracounselor model, we really focus on just 4 primary skills, right, for the paracounselors to provide service, which are like empathy, active listening, confidentiality, and then like having a non-judgmental attitude, right? So if you make it too complex, then it really becomes more difficult to actually implement it and scale things like this or provide a large population. So the proper development and going through iterations as many as needed to understand actually what is really going to work is really crucial to have a successful community-based like a mental health support program.
You have to start with community input. That I'm hearing clearly. And I think there may be some questions coming into the chat, but I want to ask Estefania, how do you convince people, particularly in the humanitarian context, that play is so important, both for the child and for the parent? What's worked for you?
Well, John, that's sometimes it's difficult because from our end, we've seen that humanitarian services are addressed towards basic services like shelter, like food, transportation, maybe other basic services. But I think that the main thing that I would use or the main idea that I would use, and actually it's something that we also used with families also, is that play is as basic as a basic need as maybe food or shelter. So I think that's a main idea that I would use, and that education services can be addressed through play, that we can, as humanitarian workers, we can provide education services through play. And this is to highlight how important and how powerful is play in these humanitarian services. And I would also highlight that all these negative effects of traveling, of the emergency, can be reduced. These negative effects can be reduced through play. So, and I finally would say that it should be easy to provide play services along the route, right? It should be easy, as if we as humanitarian workers know the importance of play and know how important it is in children development and also in caregivers and mental health, it should be easy to just create play sessions and gather materials from the environment and cooperate with these play experiences, not only on the route, but also in shelters, for example, or in places where people can sit down and rest and, as I was saying before, recharge energies. So I think it's a matter of how can we create a play movement? How can we create this whole idea that play is important and that we in these settings are not very aware of in many cases.
Well, you said movement and you said play is basic. So we're going to get buttons now that say play is basic.
Yeah.
For that. And just kind of keeping in the playful theme, Mari, you have a global initiative. How do you assure that the cultural context is taken into consideration, and what has Sesame done to do that?
Thank you, Joan. So it is not a one-size-fits-all, as you can imagine, in 30 countries globally. And as I mentioned earlier, in terms of our tool development for the research for our formative testing, it is contextualized and adapted with the local teams and goes through translation and testing as well. But not only the tools itself, also the data collection process. You need to understand what families have and have not had access to. You need to understand where they are and how they will be able to participate in the formative testing. And so, for instance, in Latin America, our teams in Brazil, Colombia, and Mexico utilize both in-person as well as remote data collection methods with Venezuelan migrants and host communities. In the Middle East, where mobile phone access was prevalent, Zoom interviews were conducted with displaced Syrian families, as well as Jordanian and Lebanese host communities. And similarly, in South Asia, our research team in Bangladesh and India adapted the in-person data collection tool methods, to reach Bangladeshi host community nationals and Indian migrant host communities. In sub-Saharan Africa, Nigeria and South Africa also employed various in-person data collections that was fit for purpose and where we were able to reach and access families. So it's not only the content, it's also the tools that you want to test with, and then it's also the data collection methods that you use to be able to reach families in all of these different places in the global south.
So the contextual, the cultural context of each country really matters, and I want to reinforce that, and I know you share that value. Let me ask one more question directly to Joy, and then we do have a question coming in about how you've worked with governments in countries, and I may ask that generally across and what barriers you faced. But Joy, how do we prepare people? How do we prepare leaders for emergencies? This is not someone else's emergency. We're all facing emergencies, as COVID showed us. How would you integrate some of these skills into any leadership program?
Yes, so John, my key recommendations are really anchored in the recognition of the crucial role of the caregivers amidst adversity. And of course, the adaptability and impact. So first, tailor the program, the leadership program that provide emotional well-being resources for caregivers, offer tools that align with their crisis context, and facilitate community building activities that facilitate or strengthen the overall caregiving network, ensuring flexibility and resilience in the face of the evolving circumstances. Second, prioritize the competency frameworks that blend technical and soft skills, empowering leaders to navigate complex situations with empathy and strategic acumen. Lastly, I think the leadership program should facilitate robust multi-sectoral support networks, fostering collaboration between local authorities, especially the Disaster Risk Reduction Office. Usually, well, in our context, they rarely meet or exchange notes and collaborate on different projects. Collaborate with the existing NGOs and community leaders to amplify the ECD's programs reach and impact. No? By embracing this adaptability, holistic competencies, and collaborative partnerships, leadership programs in ECD can truly make a transformative impact in the lives of young children, especially during humanitarian crisis.
Particularly, yeah. So flexibility, adaptability. I think we have to prepare people for this in everyday life. So we have had some people coming in and congratulating all of you. Thank you for those messages. But I do want to end this panel with any advice or experiences you had working with government and working with communities, any challenges, and how did you overcome them? And I'll open that up to anyone. And maybe I'll start with you, Mari.
Thank you, Joan. Yeah, so I mentioned in my presentation as well that Sesame do follow a model of working closely with government as well as communities. And communities do form part of our research processes because they're really partners, and we want to build that agency with communities to help us craft the content. And so in terms of barriers, I would say, especially during the COVID pandemic, when everybody shifted to hybrid and online and digital platforms, it really emphasized the digital divide that we have in a lot of these countries. Especially in South Africa, it's very prevalent. Costs of data on cell phones is very high. And so that was really one of the key barriers that has been there before the pandemic, was highlighted during the pandemic, and continues to be a barrier for stakeholders to access content when they're on the move and they have to go online, is really digital divide in terms of high data costs.
We have to continue to work on that. Anyone else want to share experiences that were successful in overcoming barriers with working with government or communities? And that question came in from Michael, and we thank you.
I can jump in. So just, I think one of the things we felt with barriers is, even though we worked with the community and developed, contextualized it, sometimes we did sometimes face barrier because the whole idea of mental health and care is very stigmatized. So people did not really want to come out and get that service. People did not take that initiative they didn't want to be labeled, right? So, and also, so what we did is we had our paracounselors were great in this aspect, that they would do multiple visits. They would continue to visit, and they did door-to-door visit is what was one way we were able to overcome this challenge. Even with the door-to-door visits, the challenge we faced is a lot of times men did not want the woman in the house to be talking to these paracounselors alone. So they would keep on being in the space. They would want to hear what's been happening. So again, in that space, paracounselors would just, create a more friendly environment, and they would just talk about other things in front of the men, but then they would try to come back and try to find a time or a slot when that woman or that mother may be available to talk, without having other people, being present while that conversation takes place. So you sort of have to work around those things, work around those barriers that do come from the community. But I think it's over time and through, trying different techniques and, strategies, you actually find out what really works.
I'm curious, did you call it mental health, or did you call it something else that was?
We call it psychosocial support. So we just said people, that's again, like with the community, we just said, we want to come and talk to you. We want you to have a space where you can just share what you want to say. So we didn't even use like psychosocial support words. We didn't use mental health. We just made this a safe space for the woman to talk.
Yeah, this is really an important point, because you bring people in, you don't want to stigmatize, right? Again, we are getting a question about, working with government. And, I know that when we're in the middle of emergencies, particularly when people are moving, there are issues on all sides with government. Any advice that any of you want to share?
Well,
yeah, sure. Go ahead.
I would say that for us in Play to Dream, regarding working with government, it was easy at the local level of the government. At each city, we worked in this training component, the second component of Play to Dream. We worked it in main cities. So it was easy to approach to local governments, and even help them to build ECD curriculums in the case, for example, of Medellin, a city here in Colombia. But I would say that there is always a barrier towards working with national level government due to, I'm sure that many countries of the Global South face those bureaucracy barriers that prevent us for reaching up some high levels and maintain some high level conversations. And I think that my advice is to gather evidence. I think that that's for us, it is the most important thing about this, because it's very important to show that the initiatives and all this technical works that show evidence that this is good for people on the move, or migrants intending to stay. So I think evidence is important. And I also think that we need to keep updated on the governmental, the government politicals as they can be changing. So we have a change of government, and we are facing changes towards their actions to help migration and migrant people on the country. So we need to keep updated on their policies and see how can we help them. But it is a work that never ends, right?
Work that never ends. That's exactly right. But I want to reinforce how important it is to stay grounded in local communities, because somehow that gets beyond the divide in the political sense. I'm going to end with you, Joy, before I move it on to
Yeah. Thanks, Joanne. For me, it's really begin the end in mind. No, start with what do you want to see? So we talk to the different stakeholders at all levels. What do they want to see in an ECD leader? And then we co-design the program with them. And then we give them back what they thought of the model. So even if there are barriers, such as we need to convene them because they're coming from different sectors, well, it's really hard to have them in one place. But since there are different platforms now, like online, that you can really get them together and then try this out with them. And that's where we can really start another program, a new design, especially for children, if we bring in different perspectives from all sectors and at different levels. Thank you.
And to prepare people for that are going to be in leadership positions for working in community and working with government, and how you find your way around the political divides that we know are out there, I think is a challenge. Well, I want to thank all four of our panel. Hope comes from doing something, from action, and I think all of you have demonstrated that. We want to thank you for all your experiences, and we want to end, before I turn it over to Lucy for her panel on parenting, to continue to speak out for peace. That's what children need, an end to conflict. And so with that, I thank you again, and I move it over to the co-editor of the book, Lucy Bassett. Thank you.
Thank you, Joan, and thank you to all these wonderful speakers. I've read these chapters many, many, many times, and I still found these presentations to be, motivating and insightful and fresh. So I hope that all of you will look to these chapters and look to these authors and their co-authors as resources for more insights, really based on experience and working with communities and partners in these countries. So we so far have heard about programs that have supported mental health, providing psychosocial support, that have emphasized the importance of play and how essential that is for healing and child development, the use of media, and the critical aspect of leadership. And now I'd like to shift a little to another really important aspect of programming for young children, which is focusing on their caregivers and parents. So we know that when children are young, they really are developing in relationship with those around them, and their caregivers are often some of the most important actors in this. They're people who are around them on a daily basis in the most intimate moments throughout the day. And while the kind of definition of a caregiver can vary culture to culture, we think about this as being anyone from biological parents, sometimes it's grandparents or other extended family, adoptive parents, foster parents, it could even be siblings. And especially in situations of conflict and crisis where people may be on the move, or there may be situations which have either resulted in the death of a biological parent or the displacement, there may be an interesting and different kind of mix of caregivers who are supporting the young child. And these programs are so important in these contexts of crisis where children really need support and stability, but also where we need to recognize that parents themselves are struggling. Those of us who are parents or have been parents, of young children a while ago know that it is really a taxing, can be rewarding and wonderful, but it can be a very taxing and challenging role. And so if you're struggling yourself with mental health issues, with trauma, with limited resources and time, and have your own emotional needs, it can be even more challenging to support young children. So I'm thrilled to introduce two authors who will speak about parenting programs. We will hear about programs in Jordan and Lebanon, and then we will move back to Bangladesh, which we heard about earlier. So first let me introduce Grace Boutros, who will share learning from a parenting program in Jordan and Lebanon. She's an expert in ECD, parenting and mental health, and she is the regional program coordinator at the Arab Network for Early Childhood and the Arab Resource Collective. So Grace, thank you for sharing.
Thank you, Lucy. And with that, I would also like to thank everyone who took part of this program, because there was a lot of effort from our team, the Arab Resource Collective and Arab Network, and Plan International in Jordan, and both MUBS, Modern University for Business and Science, and the American University in Beirut, who actually participated and helped bring the Chapter 5, Parenting Support for Refugee and Vulnerable Communities in Lebanon and Jordan during COVID-19 and Humanitarian Crisis to life. This chapter is based on our parenting program, the HEPP. Next slide, please. So the HEPP, which is the Health, Early Learning, Protection, Parenting Program, is an innovative, holistic, integrated, inclusive, and evidence-based program designed to support Arabic-speaking fathers and mothers together as a unit throughout their parenting journey with their children from the beginning till the age of 8. The HEPP was first designed in 2012, and through several implementations in Lebanon, Jordan, and Egypt, with host and refugee communities, it was updated and developed over the next 12 years by multidisciplinary and multi-sectoral experts working together. It provides a framework of concepts, knowledge, and exercises that help develop parents' knowledge, attitudes, and practices by looking holistically at the child's needs. And it builds on parents' existing knowledge and capacities to empower them to do their roles. The curriculum today consists of 38 sessions. Usually in the implementation, we use 20 sessions that are chosen based on the parents' needs. But there is an array of 38 sessions on 4 large axes. The first one is responsive parenting. That covers all the basics from development, communication, to responsive caregiving. The second one is early learning and what role parents play and caregivers play in the house outside of schools. The third one is the mental health for caregivers, because caring for themselves is as important for them to be able to care for the children as well. And the last one is the mental health of young children, but it is directed to parents. The sessions are usually led by mentors or trainers who are ECD, social work, early learning, or psychology experts. And these experts have experience working with young children and their families and have received an extensive training from ARC. Next slide, please. So the original format of, I think you need to click, yes, thank you. So the original format of the program was implemented through face-to-face sessions with groups of 10 couples through one meeting weekly in a community-based center, and it was led by 2 experts. But in 2020, and this idea has started before then, because we really wanted to see how we can make this more accessible and more permanent for parents. So in 2020, after COVID started, our team really wanted to keep this parenting support going and available. And hence, our team updated and converted the content of the program sessions into a digital format that is full of graphics, videos, voice notes, and games. It kept in mind this technology issues, but also illiterate parents who are not able to read. So we tried to minimize that as much as possible. And it's available on the Urjuha parenting website. Urjuha actually means swing in Arabic, and it can be implemented remotely with parents and caregivers of young children. In this online modality, a mentor usually sends the couple a self-paced session link, and it's usually one session every 3 to 4 days. The participants go through the session content on their own, and after each session, the couple, which is very important because we're working with both the mother and the father, schedules around a 30-minute online call with their mentor to discuss the lessons learned or challenges from the sessions and reflect them in their daily life. A last modality is currently being tested in Lebanon, a hybrid one, where a mix of online and in-person sessions will be implemented. I would like to take a moment to talk about the Urjuha parenting website, which was also developed by ARC, and it really complements the parenting program because it offers a wide variation of topics and more age-specific and topic-specific content, information, advice, and approaches. So the website offers the parents a place to seek additional information, and the social media of Urjuha keep them engaged beyond the implementation with additional knowledge and refreshers on what they took during the sessions. And engaging fathers has always been a big part of the program since 2012. And we have learned so many lessons over the years. And one of the important things is that the engagement not only happens by inviting fathers to attend, but by also adapting the implementation methodology to accommodate them and making the content engaging and interesting to them as well. Lastly, over the last decade, HAPPP has been under continuous development, review, monitoring, and improvement, and it was all backed by scientific research and knowledge. The learning from this experience are relevant not only to Lebanon and Jordan, but also to other countries in the Middle East and around the world. And while the HAPPP was in fact developed and implemented mostly in multi-crisis context, the content can be used in non-crisis and lower risk situation since its focus is on the development and prevention as well as the response. Thank you.
Thank you, Grace. That was so beautifully said, and I know it was so hard to condense all of your experience and learning from 2 countries, 3 modalities, targeting different types of caregivers, and you did it really beautifully. So please, for the audience, be thinking of any questions you have and put them in the chat. I will, unlike the previous panel, I will go right to the next one, and then most of our questions will be directed to both of the presenters here. So I'm delighted now to move to Bangladesh, to Asam Mahmood, who will tell us about a parenting program run by the IRC, the International Rescue Committee, for Rohingya refugees and the host community, again, using a really interesting combination of modalities. Asam is IRC's Bangladesh's education coordinator and leads a diverse portfolio of projects covering research, teacher professional development, kind of technology, ICT innovation, and early childhood development. So welcome, and we look forward to hearing your presentation.
Yeah, thanks, Lucy. So let me start with the name, that Jindagi Garon, the project name or the model name. It originated from the Rohingya spoken language, and the word Jindagi Garon means paving the future. So we started our project considering the 0 to 2 years of children and their supporting their parents to pave the future of the children in a humanitarian context. So that was the name. Let me start with the background of the project, that how this project came in. So early 2020, we started this project considering an integration of health, nutrition, and ECD in a place, in a service point, like a community health clinic or nutrition centers. And that was our initial plan to start that project, actually supporting the parents, particularly mothers, during their waiting time to receive the service in community health clinic and nutrition centers. That was the starting of this model. But as we already know from our previous, like Grace mentioned about the COVID-19 in early 20, when COVID-19 hit and the whole, there was a whole blockout and we couldn't execute the in-person model, and the overall implementation and all those sort of plan activities, field level activities got stopped. So we started thinking that how we can support the parents, particularly the parents of the young children during COVID-like situation. And that actually brought back the idea of a remote model. And that's from there we started the Jindagi Karan, the remote support model. But it was the very start, and there was a long way we have been covered since 2020. The next slide, please. So this is the initial model which we started very early stage of 2020, just like immediately after the COVID, when we wanted to reach our clients through an alternative remote model. So how this model we designed or we thought that we started with planning of a interactive voice response or IVR platform, developing an IVR platform and creating audio messages, and then pre-recorded those messages and delivering those messages using the IVR platform to caregivers in host community, caregivers in camps, and there is also a SMS option, short message services only for host community, because in Rohingya there is no spoken written language, so we couldn't send SMS. And through this is the initial plan, and we started with that. And we also build up a follow-up over phone call mechanism through a trained ECD facilitator to the caregivers. And we also created an opportunity from the caregivers to call back to the facilitators to understand or ask query and other things. So that was the very starting of that model, but that was not all where we ended up. We then went a long way through this process. So I particularly want to mention a lot of people's contribution, but like CCME, IRC, BRAC, who worked together in those cases, and particularly ICDDRB, who supported us developing that integrated and health and nutrition related messages during that COVID pandemic situation. And it was a quite hard job for everyone, because everyone the people who we are actually developing the service model also are affected by this COVID situation. And that was a very, very difficult situation. And adapting to this situation is quite like a situation where we learned a lot. So can next slide, please. So the model I showed is actually a pilot phase we conducted in 2020. But as I mentioned, that the pilot phase was initiated during COVID, and it was implemented also during COVID. So there was a lot of lesson learned from the pilot phase for us, which we needed to improve and apply to make the model and the caregiver engagement much more impactful and better. And then we moved to the prototyping phase in 2021 with 3 clear prototyping ideas that we will prototype and improve our model. Then we went to, in 2022, based on the prototype planning, to implementation phase. From the learning of implementation phase, in 2023, we did the impact evaluation, and in we are in 2024, and we are waiting for the impact evaluation results, and that will guide that impact at scale initiatives. So what I wanted to mention, this is quite a long journey, a lot of small learnings that build this process from 2022 to 2024. And in the book chapter, what we have in this book named Jindagi Gaurun Chapter 4, that only covers 2020 and 2021 of learning, these 2 years of learning from this project. So that will definitely, this chapter, if you go through this chapter, that will give you a bit of understanding the challenge, the needs, and other things that we started to develop. And there will be more coming, focusing on the implementation and impact evaluation phase that will actually support further on this writing. So that's a quite interesting journey for us as well, to learn and implement and also support the client, parents in an emergency situation like COVID, as well as the influx, the Rohingya crisis, the dual crisis we are mentioning, and particularly Shweta mentioned in the starting of this discussion. So yeah, the next slide. So this is a picture where we expected that parents' contribution, how it helps children. So it's a picture, it can't explain a lot, but that you can see the faces of smiling faces of parents and children and the interaction. So that's what we wanted to bring, that for the young children's development, parents' contribution is much important, and it has a sustainable impact to go forward. Yeah, over from my side.
Thank you, and thanks for sharing that photo. I agree, that just really shows the value of this kind of work. You could see not only the children looking delighted, but also, you know, the feedback that gives to the parent or the caregiver to really motivate them to continue to engage. So that was really beautiful. You said so many interesting things. And I guess I want to start with, you both talked about, you know, adapting over time, making changes, testing different approaches. I'm thinking back to the first panel and hearing about this, a little bit of a resistance to the concept of play being important. And I'm wondering, were there any challenges in having the caregivers want to engage? Were they eager to participate, or was it more like, no, this is just for kids? I know, Grace, you talked about fathers and how you were tailoring the programs. So, and otherwise, other challenges that you faced and sort of how you've overcome those. So I'll start with you, Grace.
Yes, so I think one of the challenges someone already had mentioned in the previous panel, which is the stereotype and the stigma of the parents actually coming to the centers. And this is particularly more relevant when it comes to fathers, since parenting and raising the children is usually more known or expected to be the mother's role. And there's always this dropout risk where they participate and then they start sign up and then they drop out partially. And also the scheduling conflict, especially for fathers, because we are addressing refugee and vulnerable communities. So there is this need to actually work so they are able to eat during the week. This was definitely one of the challenges, and I can reflect on two things. When it came to us repeating this implementation, and here I go back to years from 2012 until 2019, when we were implementing it in the same community, the community started having more understanding and awareness of this program and started embracing it more and started on their own signing up for the program. So this helped reduce the stigma because they were seeing their peers and other parents, and it created a community around the program. But at the same time, the online modality offered this flexibility because they are able to have the content and go through it on their own time. And they are also able to schedule their calls with their mentors later at night. So they have this flexibility and also their privacy because they are able to share more about their own lives and their children. So that would be one of the challenges. And there was a lot of lessons that we learned that really went into the implementation plan of this program. Another one is also recognizing that these parents and caregivers are facing an economic and a multifaceted crisis. And aside from their own mental health, which was a very big, important component that we really wanted to focus on, there is also the circumstances that they're living in and this stress to be able to, we're asking them along 20 sessions around 2 to 3 to 4 months to go home and practice these new behaviors. But at the same time, they're so worried on what to cook and how to make sure that their children have all the nutritional values. So we really focused here in the content on how to make it, how to offer the best solution possible given the circumstances. Like, no, you don't need to have all these fancy things, but what can you do with what you have? And we really focused on that with the learning, with the nutrition, with even how they reflect on their mental health and their mental health affects their parenting techniques and parenting styles. And on another note, it really made us reflect on this multi-sectoral collaboration to support parents. So we tried to offer an in-kind support that really was so basic that it didn't really respond to their needs. It was just some food and non-food items as well as family games. But the focus was to really for them to shift their attention to really practicing and maintaining these new behaviors rather than having to worry about their basic needs. And although that wasn't really substantial, it really did make an effect, and it highlighted how much we really need to work together and have this multi-sectoral and multi-intervention with the parents.
Thank you, Grace. Those are great examples. Assam, do you have something to add?
Yeah, definitely. I want to add something. Initially, we started with mothers, and that is our primary target, to engage mothers because they are the primary caregiver and has most of the engagement. So one of the key, we don't receive the resistance from the community. Maybe it is due to the COVID situation and people are already in the household level and were not going out there. So they wanted to engage as being part of their mental health or psychosocial well-being process because someone is providing something and they can still interact or do something like that. But we do found some interesting points from the mothers, and that also shifted a bit more of our programming later on, that the mothers said that when we are talking about childcare and development issues in the context of Bangladesh, like rural areas of Bangladesh, that the majority of the decisions are actually influenced by either husband or the father-in-laws or mother-in-laws, in most cases mother-in-laws. So there was a request from the mothers that if you are not giving the same message, same instruction to the fathers and mother-in-laws and father-in-laws, then it's quite difficult for me to practice this in the household level. So what we did, we also included the fathers and mother-in-laws or other caregivers who are available and can influence mother's decision to raise, how to raise child and what are the benefits, particularly in a context where boys are more preferred than girls. So there is a stigma that need to break. And if you are not providing the message to mother-in-law and father-in-laws or fathers, then it's quite difficult for a mother to change those behaviors. But we also saw some interesting aspects that during COVID, all the fathers were also much more engaged. But when the COVID shifted, we found that we are not getting fathers that much. So there was the findings. We tried to identify why that is happening, and we saw that as we are doing IVR messages over phone and in-person visited, we added that later in the implementation phase after prototype, and all those are reaching the mothers or mother-in-laws, not husband, because they are out of house that time. due to their livelihood activities or income generating activity. So we also needed to did a survey and identified which are the exact time or preferred time they expect that this calls or message went to their phone so that they can receive. So there is a lot of adaptation, step-by-step adaptation, each and every scale that went. But we found there were some dropouts as well from the service. So those, they might not thought that, okay, it's not that much interesting for us and we don't want it to continue. And as Grace mentioned, that there is not any in-kind support, only a bit of play kit that the parents can use to play with their children. So there is no even non-food item as well, or food item, anything. There is only a play kit that is related to the message we provide, that how they can play with their children and support their development. So that might also trigger some of the families to drop out, but majority of the cases, we found a lot more interest from the parents, and they also asked other engagement mechanisms so that they can play this role and support their children at the household level. So yeah.
Thank you. Yeah, it seems like both of you and many of these programs are just doing such a good job really observing what's working, talking to people about what they need, and adapting and modifying along the way, which is so important. You mentioned both briefly, and we saw the photo that I think, it is more valuable even sometimes. But I'd love to hear very quickly what are some of the benefits you saw from your program? Maybe one thing that you've noticed in caregivers and something in children. And it's great, awesome that you mentioned this ongoing work and learning, and Grace, you mentioned that as well. So a benefit of the program that you noticed. Awesome, we'll start with you this. Oh, Grace, go ahead.
Oh, okay. Do you want me to go ahead? Okay, so you can definitely read more, because we cannot summarize all of this right now, and I want to keep you curious, so you can go read the chapters with an S. But as we noticed a lot of improvement on the well-being of parents, their sad mood shifted, their loss of pleasure shifted, and the parenting stress index really was significantly lower after the implementation. We saw a lot of decrease in practicing physical punishment, harsh verbal discipline techniques, and even the manipulating privileges. And we also found that with children, the problematic emotional behaviors and conduct behaviors were significantly less after the program, and their parents perceived the child as less difficult. There was significant improvement in these children when it came to, they were bullying their other children less, they were more accepted by other children, they were less nervous or clingy or fearful in certain situations that they usually had. And something that I honestly am very proud of is that we didn't really, this is not mentioned in this chapter, but it was also proven in the second study that we did in 2022, is that we didn't see any difference between the improvement and changes in fathers and mothers. They both benefited equally from the program. So that really reflected that what we're trying to do with breaking these stereotypes, and especially that fathers are supposed or expected to be the more harsh or the ones who punish more. So they both benefited equally and in the same way, and we're really proud of that.
Thank you. That's so, hearing Joan talk about sort of building hope. I think you've helped us do that by sharing that. Assam, what benefits have you noted in your program?
Yeah, I will, there is a lot of benefit we saw, but I will try to focus related to the chapter. So the pilot and prototype phase, and definitely one of the major improvement, a noticeable improvement, we saw the increase of playtime by the parents with the children and weekly basis. So we wanted to see that whether the parents are engaging more or giving more time with the children through play and other things. And you know that parents' interaction has a greater benefit to the children, particularly for 0 to 2 years of children. And definitely there are other improvements we saw, that there was a increase of learning need or like expectation. So when we shared like play activities, that how they can play with their children over IVR message, there was the feedback came that it's sometimes quite difficult to understand how to do this activity and directly do that. So there was expectation from that if someone can demonstrate those activities face to face and show us how to do that, that will be much important. So you can see that they started to grow interest on those messages, on those learnings, and they're expecting that if someone can come and show us. They are not talking about in-kind support in some cases. So they are asking for learning. That's definitely a positive side, because in many cases, people ask for in-kind support and other things, but asking for support to do demonstration and do things face-to-face is quite interesting. Yeah, over.
Wonderful, thank you. Well, we're almost out of time. I want to turn this back over to my co-editor Sweta to close, and thank you both, Assam and Grace, for your presentations.
Yeah, thanks everyone. And it would be great to see all of you on screen just as we close. But before we close, I picked up on a number of themes and threads that really go through all of your presentations. So just in sum, we heard about different modalities that were used: in person, virtual, and hybrid. And all the speakers spoke about iteration, having to change last minute, having to change their approach multiple times. And I think that is, something that is not easy to do in a constantly changing environment. But all of the authors here spoke about that and their experience in that. We also heard that a number of these programs had longer term funding, which is rare actually in humanitarian contexts. And also during COVID-19, many of the grants that were provided were short term. So I think this was really great and great for funders to also hear that when you provide multi-year funding, you can really see impact of your work. When you stick with organizations that are doing great work and give them a bit more time to do it. We also heard, often governments, when they're thinking about early childhood development or early childhood education policies, are so focused on the basic academic skills of literacy and numeracy. And you heard today in the chapters that there was, really, you heard the importance of a lot of those non-academic skills, so socio-emotional skills, stress management. And then you heard the importance of play as a very basic, as Stefania said, play is basic, as something that is, very easy for children. Everyone knows it. Everyone around the world knows it. And it's, what these authors found in their work was that it was a great vehicle for children to learn and develop in a multi-crisis context. We also heard from all of these chapters the various cultural barriers that they faced, whether it was stereotypes of what women and men could do or whatever, but you heard all of them pushing back in their work on these cultural norms and breaking or trying to break stereotypes in all this. And then lastly, in closing, grounding implementation and research in people's lived experiences. I think that was another overarching thread through all of them, that when you give opportunities and platforms and voices to communities, to children, you're going to get really interesting things and interesting learning and great programs. So in closing, I just want to thank you. I hope you all, this was a snapshot. This was not the whole book. These are only a few of the chapters, but I hope it's excited you to want to dig in and read these chapters and all the others that we were not able to feature today. And, you know, I want to thank all of the authors for coming today. I want to thank our moderators. And I also want to thank our co-sponsors, so Georgetown University, University of Virginia, and Brookings Institution, for giving us this space and this opportunity to uplift these voices. So again, the book is open source. The link is there in the chat, but you can also go onto Google and just look up the name and you'll find it. You can download the whole book or each chapter. And I hope you enjoy it. And we look forward to hearing more. If you have feedback, you can always, you know, contact Lucy or I or any of the authors if you want. You can reach us. So thanks so much for joining today. And I really wish you a great rest of your day.